Hello, this is Abhinav Barnawal, a student of IIT Delhi, and I'm up here again with another video where I'm going to tell you about what is virtual patient technology and how do we use it. First of all, according to American Association of Medical Colleges AAMC, virtual patients can be described as a specific type of computer-based program that simulates real-life clinical scenarios. Learners emulate the role of healthcare providers to obtain a history, conduct a physical exam, make diagnostic and therapeutic decisions, and finally apply them to the real life. However, in contrast to the above definition, one more definition has been given by Kenny et al., who describes VPs as virtual interactive agents who are trained to simulate a patient's particular clinical presentation with a high degree of consistency and realism. Now we come to the execution principles. How do we execute them? With virtual organs, the modeling begins by feeding anatomical data drawn from non-invasive high-resolution imaging of an individual's actual organs into a complex mathematical model of the mechanisms that govern that organ's function. Now, algorithms are there which, running on powerful computers, resolve the resulting equations and unknowns, generating a virtual organ that looks and behaves like the real thing. Then, these virtual organs can be used for tests, diagnosis, and dummy operations for better understanding by individuals such as doctors, researchers, and students. Now, what are the importance of these technologies? First of all, think that if virtual humans could have replaced real people in some stages of a coronavirus vaccine trial, for instance, it could have sped development of a preventive tool and slowed down the pandemic, which could have saved many lives. Similarly, potential vaccines that weren't likely to work could have been identified early, slashing trial costs and avoiding testing poor vaccine candidates on living volunteers. This has the potential to increase success rates of various medical procedures. Further, it can be utilized for study of new complexities by doctors, medical students, researchers without risking lives, and hence it is much safer than the existing technologies. Now we come to the application areas. Where do we apply this technology besides all this importance? First of all, medical educators use VPs to achieve widely varied instructional goals, including not only teaching core knowledge, clinical reasoning, and communication skills, but also assessing learners' progress, which is very important in the process of learning. VP use in medical education is substantial. By 2007, the Computer Assisted Learning in Pediatrics program CLIPP, a VP program for pediatrics, was used in more than 70 medical schools in United States. And this is most common in clinical clerkship education, as we saw here. Now we come to one more application area, which is VPs can be used in research works, wherein medical tests can be conducted on these dummy patients. This comes with an advantage of reduced risk of lives because you're not testing on the living people, you're testing on the dummies. Now VPs can be used for nerval analysis, which has been really difficult with living beings because once the nerve is cut, you are got to die. So I've represented here an example of hurt cohorts where real patients' hurt is mapped with that of virtual patients. And so we end up here, and I thank you for watching. Thank you very much.